Can pregnant women pass the coronavirus to their unborn babies? I'll be speaking with our favorite twin doctors who weigh in on these issues and much more. We'll be right back. So if you're pregnant, recently delivered a baby, or you are breastfeeding, you are probably concerned about the impact of coronavirus. Or maybe you're planning on traveling soon and worried about your risk of flying. Here to answer these questions and much more are our favorite twin doctors, Dr. J and Dr. I, joining us from their offices. Nice to see you guys. Miss you in studio visits.
No, we love coming to the studio.
Right?
We want to see you soon.
I know, hopefully soon, right? Okay, so before we discuss the pregnancy issue, which is your specialty in COVID, I wanted to talk to you about this recent study that just came out that says the risk of catching coronavirus on a packed commercial flight is almost negligible. Now, you guys are big travelers. I know this about you. This is surprising. Tell me what you know about this.
So this is actually really interesting. They said that the risk of contracting COVID on a plane is 1 in 2.4 million.
Wow.
That's a very small number. I don't know if I would go with that small a number, but this is the thing. First of all, airplanes are one of the few places where people are actually wearing masks universally. Like, you don't have a choice. But it's also the way the air flows in the cabin. The air flows down the walls, and then it flows out, actually out through HEPA filters, and then out through the actual outtake valves. And so the air is being recirculated every 2 to 3 minutes. So with that recirculation and HEPA filters in the cabin air filtration, the likelihood of really getting any illness is pretty small.
And it makes sense because HEPA filters will block about 99.97% of particles that are the size of the particles that you see with the coronavirus. So you add to that the fact that wearing a mask will decrease the risk of transmission by 80%. You add to that the fact that the surfaces are being cleaned properly and they're being cleaned meticulously. And yeah, I mean, that number, while it seems somewhat lower than you'd expect, is actually probably pretty much spot on.
Well, I don't have a feeling both of you are now booking a trip overseas after you get off the air with me, huh?
Sylvia, I just got back from TD last week. I got to be honest with you. I have my mask on. I went.
You know what's interesting, though? It makes me wonder, so many restaurants are spending thousands of dollars on HEPA filters now, and hopefully that means that our restaurants are also going to be a lot safer. And what I also thought was interesting about this study is it said that you'd have to sit next to an infectious person for at least 54 hours to receive dangerous doses of virus through the air. So while airlines may be great, we were talking earlier about, I wonder about cruise ships. I'm still not ready to cruise yet. Do you know what I mean? And that would be more than 54 hours.
And cruise ships and restaurants, unfortunately, they don't have the same benefit planes have with the way that the air flows. So when you're in a cruise ship, when you're in a restaurant, that air more or less is stagnant. So still, if everybody's wearing a mask, the chances would be less. But in a restaurant, you have
and it's a little scary because they've done research that shows that the particles that contain the coronavirus can sit in the air potentially for 3 to 4 hours, assuming you're talking about stagnant air. And so, yeah, cruise ship, restaurant areas without high flow HEPA filtration, I'd be a little bit more nervous.
Yeah. Okay, now let's talk about the study that came out earlier this week about unborn babies and the risk of becoming infected from their moms with coronavirus. Talk to us about that.
Well, so, just in general, we know that viruses can be transmitted vertically from an infected mom to an infected baby. And other viruses in the coronavirus family, like SARS and MERS, MERS and SARS, have been transmitted vertically. And so we know that there is that risk. Now, the reality, though, is that we don't see the transmission that often. And a lot of that has to do with the fact the viral particle, while small enough to technically cross the placenta, oftentimes does not. And rarely do you see viral loads in pregnant patients that are high enough that you would see that vertical transmission.
And so what they're thinking, they have seen some newborns that are infected, but they think that either they could have been false positives or more likely the baby was infected soon after birth from mom, dad, or family.
Yeah, and the concern tends to be less with the vertical transmission to the baby, though it can occur, but it tends to be more that you see other long-term consequences from the coronavirus infection during pregnancy. We know that there's a higher risk of preterm labor. It's about 2-fold higher. We know that pregnant women who get the coronavirus tend to be sicker. They're 5 times more likely to be hospitalized and placed in the ICU.
Higher risk of C-section delivery.
Higher risk of C-section delivery, exactly, and higher risk of stillbirth. And that probably is secondary to either that vertical transmission from mom to baby or due to the fact that you just get this inflammatory response around the placenta, which ultimately can lead to damage of the blood vessels in the placenta that could lead to pregnancy loss.
I also wondered if being pregnant offered some type of protective value, because I heard the overall risk of COVID to pregnant women is actually pretty low, but if they do get sick, they're more likely to develop respiratory problems.
That's exactly what it is. So studies have shown that pregnant women are at worst just as likely as anybody else to get COVID. Some studies show maybe a little less likely, but when they do, and while the risk of death is the same as the general society as well, if they do get COVID, they do tend to have more severe symptoms. And again, if you think about what's going on with pregnancy, that uterus is getting big, it's pressing on the diaphragm, the lungs, so you're not able to aerate as well just in general. And then when you have a respiratory infection, it can definitely be more severe during pregnancy.
Well, Twin Doctors, so good to see you. Where can people go to learn more about you?
Our website,
TheTwinDoctors.com.
And the twins say it together. So nice to see you guys. I always enjoy talking to you. Have a wonderful weekend, and I hope to see you in person very soon.
I hope so. You have a good weekend.
Bye-bye.